This press briefing seeks to raise awareness of the ministry's drive towards the elimination of measles and rubella, twin diseases that can be prevented through the use of vaccines. The campaign targets children within the 9 and 59 months age bracket across the country. It will run alongside the administration of vitamin A and mebendazole to children aged 6 to 59 months. The manager expanded program on immunization, Sidat Fofana, dilated on the need for such a vaccination campaign across the country.
Mothers should know that what they were doing before the COVID is the same thing. Let them continue going to the clinic every month before the child earns 5 years of age, should go into the health facilities continuously. Those new mothers should also do the same thing. That's the only way. Before, we were not having some of these diseases. When we did the first catch-up campaign in this country, 2007, it went for 10 years. We don't have a single case of measles. But because of this confusion and this misinformation, and because of COVID, we are facing a big problem with our vaccination schedule, and this is what we don't want.
The Acting Director of Health Promotion and Education, Michael M. Mendy, also stressed the importance of the forthcoming immunization campaign.
This campaign is very much important, and the participation of everybody at all levels is very key. And in order to strengthen the participation of people at all levels, you need to inform people. People need to know what you're going to embark on. And the measles campaign, MR campaign, measles rubella, is not a new exercise in this country. And I saw about 7 months back in October, we had a campaign, and due to the coverage that we expected to be more than what we had, we are now coming up with another round in some districts, in 12 districts in 5 regions.
In a separate but related development, the Ministry of Health received laboratory equipment donated by the World Bank at the same ceremony. The latest intervention by the bank is geared towards complement government efforts towards the strengthening of the Gambia's health sector. The Minister of Health, Dr. Ahmadou Lamin Samate, used the occasion to highlight some major strides made within the health sector under the Barrow administration.
Without a healthy population, we cannot have meaningful socio-economic development. Without a healthy population, we cannot think of farming, we cannot think of good buildings, good roads. So the people need to be healthy. That is why health is a priority of His Excellency's government. And he has tasked us to fix what we met. It is a daunting task because certain areas there was nothing. Some areas there was a foundation. The foundation itself wasn't good. So you had to remove the foundation to rebuild. Some areas there was something, and we tried to build on what was there. So these have been our strategies. We need to get health care to the doorsteps of the people. So for that reason, we are building more and more health facilities in the country, and some will be inaugurated soon. And one big one is at Faratu. That is a monumental one.
The World Bank tax team lead in the Gambia, Dr. Samuel Mills, reaffirmed the bank's commitment to assisting the Gambia ensure the availability of quality medical services.
From the World Bank side, the Gambia Essential Health Services Project has supported the procurement of the laboratory equipment and the blood equipment that you see displayed here today and are being distributed across the country. There is an ongoing construction of a National Blood Transfusion Center and the National Public Health Laboratory. It's also very important that we have qualified personnel who are able to perform the laboratory services. And I think the project has supported 23 laboratory technicians in obtaining bachelor's degree. So they are more qualified now to be able to use these equipments that have been procured.
The newly presented laboratory equipment will to a large extent strengthen diagnostic efforts. Janket Toure, GRTS News.